to show you this next case, which is called the honeycomb syndrome. It's the case of a patient who came with fever to us and with chest pain. Now, this is first I'll show you the transthoracic study. Now, if you have a patient coming into an echo lab with fever, the first thing you are considering is myocarditis or endocarditis or pericarditis. This is the question that I have to you. Does the patient have endocarditis or pericarditis or myocarditis? Here is the parasternal long axis view. Here's the short axis view. I'm not going to comment too much on this, but just take a look at the images. Okay, short axis view of the aortic valve. Is this a normal aortic valve, or do you think the patient has aortic stenosis maybe? Okay. Another short axis view. The apical views are very difficult to get from the patient, so I'm using a subcostal view. Okay, Neha thinks it is endocarditis. Does anybody else think it's endocarditis? Is it only endocarditis? Okay, let me just walk you through this here. Well, this is the aortic valve. The aortic valve is thickened. There is no question. There is a bit of calcification here, and the whole aortic root does not look completely normal. Okay, there are some structures which look very suspicious. The question was, how old was the patient? Can't remember, I have to check in the database, but I think it was somewhere in the range of maybe 45 years old, a fairly young patient, not an old patient. So the aortic valve is very, very suspicious. We do not see any clear vegetations, but don't be fooled. Even if you don't see vegetations, it does not mean that the patient does not have endocarditis. But there's another thing that I want to point your attention to, and this is the pericardial sac. Look at this here. There is dense material within the pericardial sac, and this is very suspicious that there is fibrinous pericarditis with a fibrinous pericardial effusion. You would usually see this in the setting of bacterial infection or tuberculosis. Now, the patient does not have tuberculosis, but he has a very suspicious aortic valve as well. So, in my view, in this setting, you must perform a TE study. Even though I would be almost 99% sure that it is some form of endocarditis. But the finding that we found with TE was just spectacular in a negative sense. This is the TE study. What you have here is the aortic valve, and the aortic valve bounces back and forth. It's probably congenitally abnormal, but what is even more interesting is the surrounding of the aortic valve. Here we have a massive infection with septations of a large pseudoaneurysm. This here is the aortic valve, 1, 2, 3 cusp, and around the aortic valve we have a honeycomb-like appearance of a pseudoaneurysm. What is a pseudoaneurysm? I will show you later in the diagram on the slide, but here is the intervalvular fibrosa, and there seems to be a disconnection between the intervalvular fibrosa and the aortic valve. So blood can enter here and cause this structure to pulsate. What usually happens is that we have an abscess formation around the aortic valve, and then this abscess breaks through, drains, and then we have a cavity here, which in this case is septated and looks like a honeycomb. Yes, Mayada is completely correct. This is a peri-aortic abscess, which is now turning into a pseudoaneurysm of the intervalvular fibrosa. Look at the flow. You see the flow going into this pseudoaneurysm and back again. It goes back and forth. And astonishingly, there is not much aortic regurgitation. Well, there is maybe moderate aortic regurgitation, but it's not as severe as one would actually think it is based on the severity of the aortic endocarditis. Okay, so again, this is the pseudoaneurysm here. So a very, very dramatic finding. Here again, you have the disconnection in the intervalvular fibrosa here. This is the aortic valve, which bounces back and forth. Here again is the pericardial effusion. But when we pulled the probe back, we found another thing. This is the aorta. Look at the aorta and look at this mobile structure here. This might be a plaque, but with the mobile structure on the aorta, on this plaque or whatever it is, there is high suspicion that there is infection as well of the aorta. So this is, in my view, endocarditis of the aorta as well. Remember, endocarditis only means that the endocardium is infected, and it could very well be the endothelium of the aorta as well. And with this massive infection of the aortic valve, probably, bacteria are, brought downstream, and there seems to be a plaque here, and this plaque is kind of super infected, I would say, and we have a vegetation here. What was the outcome of the patient? He was operated, and everything went quite well, and he's recovering now. But the importance of the TE study was simply that it showed us the urgency of the situation and the necessity to operate the patient as soon as possible. Now here's an image of such a pseudoaneurysm. This is the aortic valve, and you see that these pseudoaneurysms can get fairly large. In our case, it did not expand here towards the right heart, but it just expanded more cranially. But this is something that you sometimes do find in such patients who have endocarditis. It's a fairly common and a well-appreciated complication of endocarditis in the aortic valve. Okay, now